I want to give you just a brief update on the impact that we're having in the community, given everything that that's going on. Since we converted to a virtual environment on March 16th, we've made meaningful connections, two-way interactive conversations with 3,400 of our clients. And for a lot of our clients, we're really the only folks in the community that is checking up on them, checking up on their well-being, making sure they're okay, trying to connect them to resources. We've actually enrolled 700 new clients over that time, a process that we thought we could only do in our offices, but actually we found a great way to be able to do that using video and phone interactions with new clients. And in fact, 460 of our clients have secured outside employment since this all began, which, considering all the challenges that the community faces, we're really, really proud of that. But, you know, I just rattled off a bunch of numbers, and we're very proud of our metrics and our numbers at Chrysalis, but if you've followed us, if you've seen our work in person, if you've volunteered, if you've been to our offices, you know behind each of those numbers is a story, is an individual with their own challenges, their own struggles, their own unique needs. And that's what I think we really excel the best at Chrysalis, is helping address those needs. You can find a lot of those stories and, yes, some more metrics in our 2019 annual report that was just published a couple of weeks ago. We're proud to report that last year we helped 2,552, don't lose those last two, jobs, which is a new record for Chrysalis. We're very, very proud about that and the stories that go behind it. And in the chat is a link to our website, so you can check out the PDF version of that annual report, which, by the way, Tiffany, the woman that was hosting us tonight, that is her project. We're very, very proud of the work that she has done. It's an amazing piece of work, as well as the rest of the staff that helped put that together. Now, when we pulled all our statistics for the annual report this year, we did some demographic analysis and, and found that 81% of our clients reported that they either are currently experiencing homelessness or housing instability. And as tragic as that is, we know it's not a surprise to us because the latest Los Angeles Homeless Services Authority count found that the #1 reason that people find themselves without housing is loss of a job or other economic disruption. So with the pandemic, you can imagine how much that is impacting the clients that we serve. And better to have some of our experts share some of the stories and what they're experiencing directly on the front lines. So I'd like to welcome Molly Larson, our Vice President of Program Operations. Molly oversees our 5 Chrysalis client centers and all of our direct service staff. Needless to say, she's a little bit busy these days, as are her entire staff. Molly, thanks for joining us tonight. Take it away.
Thanks, Mark. And I'd like to invite all of our panelists to join me on screen here. We're going to do a quick round of introductions for everybody. So we're just going to share our name, our pronouns. Equity and inclusion is one of our core values as an organization. So we've made it a practice to share our personal pronouns, whether it's in meetings like this, in our email signatures, as we introduce ourselves so that we can create a welcoming environment for everyone. And then also, since we're all about jobs, we're going to tell you what our first job was. So I can kick us off. So as Mark said, my name is Molly Larson, she, her, hers, and my first job was a hostess, and I made it one day.
Emily, I need you to click on mute.
Sorry.
TV.
Excuse me. My name is Emily Dannenberg, she, her, hers. My first job was as an environmental landscaper, which I was not super successful at.
My name is Brittany King-Pleas. My pronouns are she, her, and hers. And my first job was actually a tutor, and I lasted the summer.
Hi, my name is Gabe Mendez, Employment Specialist for the San Fernando Valley Center. My pronouns are he, him, his, and my first job was a floor guard at a roller rink.
Hi, good afternoon, everyone. Roger Rivera, pronouns are he, him, and they. And my first job was I sold newspapers, and that lasted a day. Didn't last too long.
Great, thanks everyone. This is Abby, who apparently will also be joining us. So since we took our services virtual in March, Mark mentioned that we've welcomed well over 600 clients to our program. And I wanted to kind of kick us off in learning about the new client experience. So I'd be curious to hear how clients are hearing about Chrysalis and what support they're seeking from Melissa, who is actually the first person that many of our clients meet when they're welcome to Chrysalis. And then from Brittany, I'd be curious in finding out more of kind of the immediate needs that you're hearing from clients during our initial one-on-one assessments, and maybe how some of this has shifted or changed since the start of the pandemic.
Hi, Molly. Thank you. And thank you everyone for tuning in into our community broadcast. We're so excited to have you all here. Clients are really finding out about Chrysalis through word of mouth. So whether it's family, friends, or current clients that we are serving at this time, they have found our program extremely helpful to their lives. They actually refer clients over to us, and from there I'm able to connect with them over the phone. And I onboard new clients by going over our program as well as conducting a phone intake with them. The most onboarding that I've done in one day has actually been like around 12, which I find very beautiful because out of that one client could be those 11 referrals. So word of mouth has been extremely helpful to our program, as well as getting the word out about how we can assist our clients. The support that someone is seeking from Chrysalis at this time, as Mark mentioned earlier, the clients that we work with, they may be experiencing barriers, so experiencing homelessness or affected by the criminal justice system. However, what's very interesting that's specific to this time right now is that clients really are seeking to hone or transfer their skills into another field, so making that career change. Because of the pandemic, many of our clients have been furloughed or they've been laid off. And so they are now looking to find employment in a more prominent field or industry. For example, we've assisted many clients who have been working in the hospitality and restaurant industry for over 20 years. However, that field is not rising at this time due to all the closures happening in California. And so they're looking for employment in like healthcare, for example. And so since it's been such a long time, they've never amended their resume or had an interview in years. So that's where I've been able to assist them with these one-on-one virtual services. But they've also worked closely with their employment specialist on working on a plan to obtain that specific job, whether it may be obtaining a certification or a training, or really just relearning the basics of, finding employment.
Melissa, it was brought to my attention that I may have been so excited to jump into the panel that I cut you off before you could introduce yourself. If that's so, can you please introduce yourself? And my apologies.
Yes, of course. So my name is Melissa. I'm the client services coordinator in Santa Monica, she, her, hers. My first job was actually at an animal shelter in Washington State for about 4 months. It was in 9th grade.
Thanks. This is a luxury for me to have this many of the team in one place at one time to share information. So I'm just excited. Go ahead, Brittany.
And then I would say when they first, the new clients that are coming in right now, when they're first starting, definitely housing is a #1 concern, whether it's supplemental, to whatever their rent is, or it's just figuring out how to speak to a landlord or how to navigate or find resources for that. And I would also say access to printing resumes, just being able to apply for a job, it's on your tiny phone. It's hard to, if they even have a phone. So there's filling in for that basic need as well, in addition to access. So it could be toiletries or hygiene. Whereas before clients, I feel, we're just looking for those job leads. And although, the clients that are coming in, they know the reputation of Chrysalis. So many of them are coming in ready and interested. However, the basic needs definitely are barriers to employment. And just like Melissa said, in regards to transitioning, so giving them that guidance and that support, that whatever skills they have, those soft skills, they are transferable, and the experience that they have is valuable, and that can be translated to different jobs. So being open to the guidance piece, more of that is really essential with the new clients, and that's how I would say it's changed a lot since we started.
Great, thank you all for that. And I think, you know, as we think about new clients, who are we serving? And Chrysalis is here to serve anyone who's ready, willing, and able to work. And we're lucky to have two experts here, one in the Latinx community and another in the reentry or returning citizens community, Gabe and Roger. Can you share a bit about how the pandemic has uniquely impacted job-seeking clients in each of these communities? And we'll start maybe, Gabe, with you and talking about the Latinx community.
Sure, thank you, Molly. So more than 65% of our San Fernando Valley Center client population identifies as Hispanic or Latino. This demographic has been highly impacted by the pandemic. In California, 39% of our population is Latinx, and Department of Public Health data has shown that this population represents roughly 55% of all people infected with COVID-19. A client I worked with was laid off in March due to the pandemic. She takes care of her son and her husband, who is on disability. And while her husband sleeps, she bakes sweetbread and sells it on the sidewalk to earn money for food. When she's unable to make money, she reaches out for help. So through a Chrysalis emergency funds request, we were able to help her family pay for essential utility food bills, essential items, and doing all this while working together to find stable part-time work so that she can continue to care for her family. She, like other clients in our program, are undocumented. So they have the same they don't have the same access others have to stable jobs, financial aid, or housing opportunities. So these clients are most vulnerable during this pandemic and lean on us for guidance on how to connect with legal, medical, counseling, and other essential services. Clients are also requesting educational resources to improve reading, writing, and computer operating skills. So we take our time to help clients complete the forms or applications they need so they can connect with that service or job that they want to apply to. Help is also needed for clients who don't have the basic tools such as phones, computers, internet service, to participate in our program and effectively search for jobs. So during this pandemic, these clients work closely with us and depend on us to help them update their resumes, complete online job applications, and whenever they need us to. Word of mouth is an effective way of getting the word out about our program, so as well as jobs here in the Valley. So Chrysalis staffing program has been instrumental in helping some of our job-ready clients obtain temporary work. And the thought of returning to work can be scary sometimes. So as it was for one of my clients, it was a hard decision for him to make, but he said it was back to work and being exposed, or stay at home and risk losing everything, having no income. So through a Chrysalis emergency funds request, he was able to get the masks, gloves, work boots, and hand sanitizers that he needed to keep him safe. He reached out to us recently to say he's doing well and to share some good news that he was hired full-time, where he started with staffing during the pandemic. The most requested resources are food, personal hygiene products, clothing, transportation assistance, and personal protective items like masks, gloves, and hand sanitizers. As I mentioned earlier, other essential tools needed for clients to maximize their job search efforts in this virtual environment are phones, computers, internet service. These essential items and resources go a long way for our clients during this pandemic. Thank you for your help.
So I can, I'm one of the Breaking Barriers employment specialists, and I work directly with the clients who have previously experienced incarceration and who are on active probation. So the pandemic has significantly impacted our clients' ability to maintain and find employment. Majority of my clients on my caseload right now were ultimately laid off due to the pandemic and having difficulties navigating different systems without computer and internet access, such as filling out the unemployment application, submitting an IRS non-filer application to receive their stimulus check, submitting their CalFresh application so they can purchase groceries. So during this time, we've been helping clients navigate these different systems. In addition to that, one thing I've experienced as well is we found a large group of clients just waiting for systems and offices to reopen to access services. For many of my clients who don't have a ID or social security card, it's difficult and almost impossible to find employment without those legal IDs or identification documents, or having to deal with accessing the court systems to address traffic citations to obtain a driver's license. So I find that a lot of our clients' employment goals have been put on pause until these systems reopen. Another thing that I believe that clients are waiting on are training programs. We have a lot of our clients enrolled in various training programs to obtain a certification or vocation, or learn some type of vocational trade that provides them a pathway to employment, such as commercial truck driving or construction. And ultimately, many of these training programs have been put on pause until further notice, until we find a different way, or until they find another way to deliver their services. But another theme that my clients are kind of dealing with is just the challenges having to pay for immediate expenses, such as just phone bills, groceries, utilities, transportation. It's hard to communicate with as an employment specialist with a client who doesn't have access to a phone. But I'm happy to acknowledge that with the help of my colleagues, we were able to connect 50 clients to the Returning Citizen Stimulus Program that provides folks that have experienced incarceration $2,700 to help them pay for day-to-day expenses. And one of my clients was able to use this funding to help pay for her deposit in securing her unit. So those are kind of the themes that I've noticed with my clients.
It's great. Thank you both for that information. And as Tiffany mentioned in the chat, please continue submitting your questions, audience, that you might have, because we're coming up to the time where we want to answer some of those. But before we do that, we want to talk about jobs, which is why we're all here. And I'm going to invite Emily to help tell us some things there. As Mark mentioned, we've had more than 400 clients who've actually secured employment since our services went virtual in March. But we know the road ahead is a long and winding one. Emily, what are you learning from clients? Are those individuals who were furloughed previously getting rehired, or what trends are you seeing in time to actually get hired or find a job?
Sure, thank you, Molly. So I will say at the beginning of the lockdown and the pandemic, a lot of clients were optimistic that their jobs would be coming back. So they took a little time, they said they'll wait to find something new in hopes that they'd be able to transition easily back into their old place of employment. I found that in the past month or so, as cases rise, more and more clients are starting to realize that that might, if they do go back, it will be a while, and even going back is not necessarily a guarantee. So the job search has started at full steam ahead. And a lot of my clients are looking at changing careers, or at least adapting. So as I think Melissa had mentioned about those who are working in hospitality have started looking into working in hospitals. A lot of those requirements are consistent across the board. So a client who was a house person and took care of, and was a room attendant and did custodial work and maintenance at a Marriott in Long Beach is now an environmental services technician at St. Mary's. So he used those skills that he had and is now was able to find new work in a similar environment, and he's extremely happy that we were here to kind of point him in a new direction. That's the same with food service. So we know that restaurants thought they were going to be opening again soon, and that's kind of had to backtrack. But using that customer service and using that service intuition that people have built those skills in with food service, we're parlaying that into other areas. The big job markets or job industries where we're finding work, custodial work, of course, there's always going to be a need for people, especially now when everything needs to be sanitized and cleaned to the highest extent. We've also had a lot of developments in social services. Now that these temporary shelters are going up, more people are able to work as a residential monitor, work in various shelters. I know Volunteers of America, we've had a number of clients get hired there. Warehouse, delivery services, of course, security. So what we always tell our clients, employment specialists, is if you're open to adjusting your employment trajectory, and if you have experience and skills and you're willing to work with us, we can find you a new path to employment. And I think many of the newer clients coming in are really under the impression that there just aren't jobs available. And they don't really know where to begin with the job search in this new COVID era. So just hearing from us that there are jobs out there, they're willing to adapt and use their skill set in an area that might not be super familiar to them. They just need some guidance. So all they need to hear is that there are opportunities. And then those clients who either, have to take off from work because they have to take care of children or they're in a high-risk group, we are offering, and I think this was mentioned before as well, various training opportunities so that they feel like they're at least using this time to boost their employability once they can go back into the workforce. I have one client who has been staying home with his son, and he has now completed 3 incredible workshops through UCLA, a partnership through UCLA and the Department of Mental Health, so that he's working towards becoming a counselor for a drug and alcohol counselor, and he wants to focus on working in shelters. So he's taken trauma-informed care workshops. He's actually taking one tomorrow with working with the chronically homeless. Maybe he'll work for Chrysalis one day. I don't know, we're kind of molding him to be a Chrysalis person. So there's definitely opportunities, and as long as clients know that we have their back and that there are people out there looking for job leads. I know our direct hire staff is out there working with employers who know how hard our clients work and how dedicated they are. So just keeping them motivated and knowing that there is work out there. It's a little bit harder to come by, but we're there for the long run.
Thanks, Emily. I think one of the things that we do, and I'm sure all of you have seen from our panelists tonight, is we provide hope and support for clients because we'll help them get there. It might take a while, but we're definitely in it together, as Emily mentioned. So before we turn to our audience questions, Mark, if you could join us on screen again, we wanted to ask you kind of what's next and where do we go from here?
Are you asking as the public or are you asking as a staff member, Molly? Is this a trick question? No, it's actually, this is the question that's on everybody's minds, right? Whether you're a staff member of Chrysalis, whether you're a community member, a client, what's going to happen next? And all I can tell you is that, first of all, we've got our essential business operations. All of our Chrysalis Enterprise businesses are essential. They've been operating since day one with a great safety record, and was talking to one of the supervisors the other day, she was emphasizing how important the safety is, and if she's talking about it, I know all of our crews are. So we're delighted to be able to continue to provide that community service and that work hours. Over 400 clients worked for us last week. For providing additional in-person services, we're going to watch the data and we're going to follow the trends, and we're going to do it when it's safe. When we do begin to reintroduce services, we'll make sure that they are aligned with our mission and aligned with the specific needs that our clients have during this pandemic, but also with safety as being the #1 watchword. It's going to be tricky, and I got to give a lot of credit to our team, many of whom on this call tonight have been helping us think that through. It is not easy, but we're going to figure out it in a way that is supportive of our community.
Great, thanks, Mark. And then we have time for 1 or 2 questions from the audience. I'm going to go ahead and just answer one about if a question came in. Do we assist undocumented individuals without a work permit? Yes, we do. And then Brittany, if you can help answer, are we seeing a larger number of clients coming in for help due to massive layoffs, and is the number growing?
So I would say yes, definitely. Clients have been laid off, or they just were looking prior to COVID, and then it's just prolonged it since they started. So And I would say the number growing, I'm not really sure. I would say that many have referral, like Emily was saying, and then they kind of thought by now that they would be working again or have more hours, or they have limited hours. So some layoffs, but I think just the timing for many, it's just prolonged the job search even more. So that's what I would say.
Yeah, that's great. And I think as we go into kind of this second part of the first wave of the pandemic, we're seeing trends change even within this. So we have a lot to be responsive to make sure that clients are getting all of the support that they need, the ever evolving needs. We're here for them. So I'm gonna take this time to wrap. Our time flew tonight. I wanna thank our panelists, not only for their time for this evening after a long day of work, but also just for being great colleagues and incredible advocates for all of the work or all of the clients who need you and count on you every day. I am honored to call each of you colleagues. So thank you, thank you, thank you. As Tiffany mentioned, we do have our next community broadcast coming up on Tuesday, August 18th, and this one's going to be at 3 p.m., so a little bit earlier. We're going to put that link in the chat. Again, I'd encourage you just to sign up now. You don't need another thing for your to-do list, so just sign up and then we'll send you the email reminder when we get closer. And we're thinking for that one that we're going to actually be able to take you on kind of a virtual tour of some of our centers to see how we're preparing for additional in-person services. So if you want to see more than just our living rooms, it's something for you to consider. So go ahead and sign up, and thank you for all of your support. Stay safe and be kind, and we will see you August 18th.
But Molly, if we do that, I won't have an excuse to get flowers. I want
flowers are on point, and I have my plants on my wall, so
nice.
Bringing nature in.
Thanks everybody for joining us tonight. Thanks Molly for hosting. Thanks to all of our panelists. So proud to work with each of you every day. Doing amazing work. Good night, everybody.
Seriously, thank you. Bye. Good night.